Welcome back to the Morristown Market Report. I'm Amy Schrader with Remax Real Estate 10.
And I'm Kim Swan with Union Home Mortgage.
And today our special guest is Donna Shampine with Renu Laser Medical Spa. Welcome.
Thank you.
We're excited to have you here.
Thank you.
All right, so tell me a little bit about what it is you do, what services you offer.
Okay. Well, as you said, I'm with the Renu Laser Center and Medi Spa. I guess part of the name speaks for itself. I do laser, like a lot of laser hair removal for men and women. A lot of ladies have, especially if they have any kind of thyroid or hormone disorder, anything like that, then that could be a real problem. That's a problem that women just should not have to deal with. I do medical skincare, pretty much anything short of injectables like the Botox and Juvederm. I don't do any kind of needles, anything like that, but I do a very aggressive medical skin treatments, like from the deep chemical peels all the way down to refresher peels, microdermabrasion, hydrodermabrasion, and electronic lifts, things like that.
Okay. So who comes to you? Like, what causes someone to come?
As far as most of the laser part, it would be mostly women with PCOS, or like I said, some kind of, that usually it's facial hair that they deal with, or then sometimes women just, I guess, get tired of shaving with their legs, arms, and men come for laser hair removal as well, mostly for chests and backs, especially like if they, on the lake a lot, or in a pool, or lift weights, or whatever at the gym, they will come, or their wives send them, whatever. But anyway, and then people come to me that have, they're really more interested in preserving younger looking, healthier skin without having to undergo more aggressive procedures. And if they do, have, surgery, like I have ladies that come to me all the time that have had facelifts or lower neck lifts or whatever. And the things I do help preserve their results, basically. People come to me that, now a lot of my clients do go, other places and get injectables and whatever, and absolutely no judgment. I think anything you can do that makes you feel better about yourself, go for it. But
that's what Dolly says too.
Yeah, I'm a Dolly on that one. Except I don't do all that because she is going to have the money. But people, that sometimes people come to me because they want to avoid these type things as well. So, and a lot of people, I guess the correct term for what I do is medical esthetician. Now that I am in a medical environment and have a medical director, which is Shaheen Asadian, and he's a vascular surgeon here with Health Star, but we are on a separate building. But you get people, I guess, from all walks of life, every nationality, I think, that's located in this town. I have, just people, just in general, but it's mostly women, but I'll say about 25% male clientele.
Okay. Well, what inspired you to become a medical esthetician?
Well, aesthetics were always my end game, and I went as a very young person, and I actually got my licensure and all that, and passed my boards. Of course, at this time, years ago, and in this small of a town, 99% of people wouldn't even know what an esthetician was.
Right.
So anyway, at the time I had all three of my children, and the baby was ready to go to preschool and all of that. I got a call from a Donna Word that owns she and her sister owned the nail shop. It was like probably the first nail salon in town, I guess, and she wanted to go full service. So she had heard that I did have my esthetician license, even though I never had a practice. Would I be interested in working there? So I started my career there before I went into medical, and I stayed there probably 11 or 12 years. And then when I had the opportunity to go medical, I jumped on it because now, I can just do so many more things and more aggressive. And as far as not just the laser hair removal, I do laser skin rejuvenation, IPL photofacials. They are done with a laser type procedure as well, which they are just, they're amazing what all they do, but they really, they can be targeted, like for people with rosacea, the real redness in the cheeks. You can go back and put a certain light filter in there in a certain setting, and it will help just even out your skin tone. It helps with uneven skin in general, like melasma, sunspots, things like that. And it's just a great anti-ager. And so, I do a lot of things like that. Those are like really quick procedures. You'll be in there 20 to 30 minutes. things like that. But I guess that's just something I always wanted to do. My mom got me in the habit when I was a little bitty girl. Every Saturday night we would put on our facial masks so we'd be ready for church the next morning. So it's just something I always wanted to do.
Well, that's pretty cool.
That's awesome. Now, when somebody comes to you, like, could you, like, say, for example, I came, you're going to see where I'm going to always use my sunscreen through the years, but do you kind of assess and say, okay, I think with, you maybe need this many treatments, or is that something you can kind of advise people on?
Yes, it is, and I usually try to have printouts, like protocol or whatever, how many visits you may need, this or that, or say, for example, protocol years ago when I first started in medical, in the laser hair removal and reduction was like, 6 and you're done. Usually not so. Sometimes you can be done in 4 or whatever and get 90% results. It will be pretty much the maximum you can expect, and I try to help people whether they're about hair removal or anti-aging, whatever. I try to give them realistic expectations.
Sure.
And if it's something that absolutely I can't touch, I'm honest about that and say, maybe you need to go see a plastics or, a derm, somebody that's something real specific. But yes, I always try to do a little consultation with everyone before we start anything.
Good deal. So what are the most common skin concerns that people come to you with?
I will say off the top of my head, acne, even adult acne, rosacea being, redness and the broken capillaries. And I do have a separate little vascular laser as well, that if the IPL and the mandelic acid peels for redness, if they don't get the desired results, say if the capillaries, they run in the face and they're kind of wide, that the IPL won't, take them away totally. I have a little vascular laser that we can just zap those, and in one treatment they're gone. So, but yeah, the redness, the rosacea and generalized redness, melasma, acne, and just sagging skin in general, I guess, is part of it.
I'm thinking I'm going to need to call her.
Well, I want my skin to look like hers.
I know, I'm sitting here just admiring her skin. And
It's getting some age on it.
So I guess sunscreen, how important is sunscreen? On a day like today, everybody I'm sure is
it's mega important. It's so important. I tell the ladies that come to me and they're like, I don't want to put all this layers and all this stuff on my face. I'll say, well, okay, as long as you wear a foundation that has an SPF of 30 or higher. But what about your ears, your neck, your chest, whatever, your hands, excuse me. Hands are where I have because we all wash our hands a lot, basically. And we have, forgetting to reapply, I guess you would say, is part of the problem. But, excuse me. The sunscreen, most people think that I'll say, well, I wear one that's 100%, and nothing's 100%. And as we're talking about sunscreen, and I said nothing is 100%, especially in protection. But what I try to emphasize to people is that really strength-wise, there's really nothing higher than a 30. But the higher the number, usually the more expensive the product. But it's a reapplication time is what that means. Basically, a 30 will last twice as long as a 15 SPF.
Okay.
So I always buy 50 when I go to the beach.
Yeah,
so you're telling me 50 isn't really
well, who wants to apply when you're sweaty and you got the sand and the grit? So yeah, right. I do buy the higher numbers just because I don't want to reapply.
Okay.
Yeah.
I was thinking I was totally wasting my money on that. All right. So what kind of advice would you give to someone who's looking to get into this kind of a field?
There's a huge amount of overhead. First, I guess
sure.
It's a big investment, but you're better off, financially not having as much startup cost if you do have a medical director in a place that's already existing. Basically, if you can walk in a place that already has clientele built in, that would be a huge help.
All right. So, how do you ensure that your patients have a safe experience when they come to you?
Safe. I said, okay. Well,
like you don't have anything that goes wrong. You
could. Of course, there's just like in every medical office, you have release forms and do's and don'ts. I advise people if they're coming in particularly for any like IPL photofacials or any kind of laser, no tanning at least a week prior. And I, of course, I don't recommend tanning, period. I mean, no, we all like it, but it's, really not great for us. But no current fresh suntans, and no actually spray tans or self tanners, because the melanin in those as well will draw the heat from the laser and make you more prone to burn. And when they chemical peels, I just use protection on the eyes in case they were to run or whatever, and Vaseline the lips up good. Just keep the product where you want it and out of where you don't want it. So I try to take every precaution I can to protect people.
And what do you do, like, to just keep up on, like, the latest, greatest products and services that are offered and things like that?
Well, pre-COVID, of course, we're always lots of continuing ed. Some states require it, some do not, but I always do it every opportunity that I would get. And of course, since COVID, there's not as many one-on-ones as there used to be, and not as much travel. There's more webinars and things like that now. It's mostly, I'll say that's about 75% of my education now will be online webinars.
How do you like that, as opposed to getting it in person?
I'd rather be in person.
I hear you. I lose focus so easy if I'm having to watch a webinar, and there's so many distractions that you can turn off if you're one-on-one.
Right. Yeah. If you're if you're doing a webinar and you get text or calls or whatever, it's just too easy to lose focus, I think. And I was very fortunate enough right before COVID to have about a 30-minute one-on-one with Dr. James Beckman, who is the founder and owner of Theraderm, which is the line we carry, medical. And he is in mid-80s still. He's also a retired biochemist, a retired burns plastic reconstructive specialist. He believes in the body's ability, the skin's ability to heal and restore itself, and that's what his products focus on. And he also, I use 99% of his chemical peels as well.
Okay.
And just that blip in time with him, I learned more in that 30 minutes than I could have in 3 hours of a webinar, basically.
Good deal. All right, well, we're going to ask you the final question, and this is a question we ask everybody that comes on here. Okay. If you could go back in time and give your 20-year-old self one piece of advice, what would it be?
Extremely limit your sun exposure. It's true. I mean, and I never did tan a whole lot, even back in the day before tanning beds. Like I guess I just couldn't tolerate the heat. I wanted to tan just like all my friends, but I just couldn't do the heat that well. So I guess today that's a blessing probably. But yes, just and I don't avoid outside. We have a boat and we live near the lake. I love it. But just protect your skin. And anytime I see something on someone's face, even to me, if it just looks like something as simple and harmless as seborrheic keratosis or just a little sunspot or whatever, I say go get it checked. That's because you just know, the look of cancers changes all the time and evolves. And even on people that haven't sunned in 40 years, they could see. I had one client that went, it was a very rare form of skin cancer, very rare. And I'd never even heard of it before it was so rare. And it is very aggressive, and I'm glad I sent them. It's on their face, So just anytime I see anything I'm in doubt about that it's above my pay grade, I'll try to send them on.
And you're right about that, because like my dad worked construction late 70s, early 80s, and in the past probably 5 or 6 years, he's had several little skin spots come up that were cancerous. They've had to remove them. And it's from where, as a man, you're pulling your shirt off when you're out there working on the house because you're hot.
Absolutely.
Men don't care about sunscreen, I don't think, near as much as women do.
No, they certainly don't. But I can remember my father and my uncles, when they would farm, like long sleeves and gloves and hats, even before we'd ever heard of sunscreen,
Yeah, that's true too.
So that's good.
All right, well, thank you, Donna, for being our guest. If people want to get in touch with you to learn more, how do they do that?
You can just call the main office there at Renu Laser Center / East Tennessee Vascular. That receptionist, she takes care of both our, both lines basically, and she gives me messages and I do my own scheduling. So it's easy there, or they can even private message me on Facebook.
All right, good deal. All right, so Kim, I might ask you real quick because I know they're not real good right now. Where are we at on interest rates?
They've moved up a little bit more. We're probably now, low to mid sixes. We did get some news yesterday that VA has reduced their funding fee.
Oh, that's good.
If any veterans out there looking to purchase, those figures have been reduced on the percentages of what they charge. And there's talk that this afternoon there's going to be maybe a potential reduction in the FHA mortgage insurance as well. So hopefully we'll talk about that next week. So.
Yeah, I find it funny that the government's doing these things, trying to make affordable housing a thing again, and it's like, it's not affordable when the interest rate's 6.5. You know, you got to get that under control.
Yeah, the things they're doing is not offsetting the higher interest rates by no means.
Right. So, all right. Again, I'm Amy Schrader with Remax Real Estate 10. If you have a small business that you would like to have featured on our weekly podcast, please send me a DM or leave a comment below.
And I'm Kim Swan with Union Home Mortgage, and like Amy said, we'd like to see a lot of our local businesses and small businesses spotlighted here with us.
Thanks so much, and we'll see you next week.